We talked a lot about the UK companies that you came across, but I would like to kind of dig deeper into those 100 countries that you either worked with or visited. Based on the experiences that you had so far, can you name any interesting examples of how you perceived other healthcare systems? What are the things that kind of gave you something to think about?
Let's start with a global overview. Most digital health companies will eventually go for the US or China. That's where the money is. And the US advantage is that they're very good at taking something and commercializing it and packaging it. So if you get acquired or invested in by an American company, you're going to do a fantastic job of becoming a world-leading product. Other countries aspire to it. So that you've got a mid-level, and in the mid-level I would put France, I would put Germany mid-level. And then you've got the smaller countries who are nimble. That's where Israel, Estonia, Finland, that's where they play. South Korea I'd also put in that zone. Singapore wants to be in that zone too. Then underneath it, the countries that need more help. So weirdly, I would put Austria ahead of Germany, right? I think Germany is big, but Austria is more advanced. So you get weird things where a more advanced country is right next to one that isn't. It isn't about region. It's about level of maturity. And typically you see the amount of money available in that system. Going all the way down, when are we going to see countries from the GCC, so Dubai, Abu Dhabi, starting to export out? We've got lots of companies going into them, and their systems are becoming quite cool. But when are we going to see them developing? So some countries are really about pushing their tech out because they're so good. And those are the ones that are the most interesting. So when you go to HIMSS Europe in Helsinki, you'll see some fantastic Finnish companies. And that tells me not only is the system strong, but they're strong enough to export. And I think that's where the real focus is for digital health worldwide. Some interesting companies in Brazil, some in Africa, but majority of the interesting ones are in that zone, the nimble zone, which is definitely Israel, Estonia, Finland, maybe the Netherlands. And I'd like to think the British are somewhere in between. They're mid-level in size, but they've got the agility of some of those smaller countries.
I find it interesting that you mentioned that digital health companies would eventually want to land in the US and China. Obviously, the US is pretty clear, no question there. However, I would like to see if you can expand the thought about China, because China is big. The Chinese are very innovative, they're very competitive, they're very hungry for innovation and success. And also the culture is specific, the language is specific. So there's just so many barriers that I see that I find it hard to imagine how you would even start considering that market, and how long would it even take you to enter it?
The first is that China's a bit like Dubai, where they want you to come in so they can work out what you do, so they can destroy you and defeat you and be better than you. The goal is, we might not be as good as you, but give us 3 years. We're going to be better than you. And China very much has that feeling. So the opportunity for good technology, really clever technology to get into China and make lots of money is available. But the goal for China is, we're going to learn and we're going to beat you. We're going to have more AI papers than anyone in the world. And they are now. More publications in AI than the US. More money available. The size of the market is huge. So the opportunity for companies is, do I avoid the Chinese market, knowing that they're going to try and accelerate? Or do I just enjoy the ride? And the money's huge. How do you take China? Even Coca-Cola had to go regionally in China because it's that big a market. You had to go slowly. Once you've got a route into China, however you get it, and it might be primary care, it might be secondary care, whatever the route is, the challenge culturally is that China doesn't traditionally have primary care. Their goal has always been, I'm going to see a doctor, and if you're not a doctor, you're not good enough. I want to get to the hospital. But they've done something interesting where they've got everyone on the mobile phones. So Ping An, Good Doctor, now everyone is able to access healthcare on their phones. So they've jumped an evolutionary step into the modern world, but they've missed out their primary care bit, which is where Israel, Finland and Britain would argue that we have strength. So there's a big call in China for you to help them with primary care, community radiology even. Those are the things that the Chinese have been asking for.